Hi, I'm Janet Gross. Welcome to Coping Today, a place where we talk about mental health and well-being, things on our minds, even things that can weigh us down, interfere with life. Today we're talking about depression, symptoms, seriousness, and types. Dr. Roy Salgado, professor of counseling at the University of Holy Cross, is here to sort that out and talk about this with us. I don't know anybody who hasn't been depressed at some point in their life.
Right. We all experience some level of depressive symptoms. You know, we experience sadness, grief, loss, the blues, and it's important to differentiate between what would be considered perhaps the natural response to life's circumstances that perhaps produce sadness in us and even mild symptoms of depression, as opposed to a clinical diagnosis of depression that can impact in a very significant way various areas of our lives.
So that's when it goes beyond a feeling, beyond a mood, beyond an event, I guess?
Yes, and that's a very key thing, because we can all feel sadness or grief or have a response to an event, the loss of a loved one, the loss of a job, maybe just hearing about something that is just unsettling and just very emotional. Mm-hmm. That's a typical thing that we all experience, and we can even have it for a prolonged period of time if it's something that really impacts us. You know, we lose a parent or a spouse or something.
You think about it a lot because the moments hit you.
Exactly. Oh. And then when you come across something, it's, oh, we used to do that, or I remember when, and so then that sadness ensues, and then it can be very depressive. Mm-hmm. Those are natural responses. Depression is a condition, a diagnosis that really impacts in a negative way people's daily living activities, work, school, relationships, social life. And when we find that those areas are really impacting us, including our physical response too. Sometimes we feel like our bones ache, our muscles ache. Yeah. We feel it in our bones, that deep penetrating sadness. Then we perhaps might be experiencing symptoms of depression.
So we're really, I guess we're using the word in just regular talk. We're using the word depression wrong because, yeah, I'm depressed. Right. That's just, I'm sad. Or there's another emotion that goes with it, not depressed.
Right. We use that term a lot. Yeah. And I don't want to tell people not to use the word. Yeah. You know, it's like, don't use that word. It's you're using it inappropriately. Mm-hmm. But we really are using it inappropriately. We say, oh, I'm so depressed. Maybe you're sad. Maybe you don't like something. But I don't know that you would necessarily meet the criteria for depression. Depression is something very different, and it is a diagnosis in the DSM, the Diagnostic and Statistical Manual, and there's a variety of different mood disorders. It's one of varying mood disorders. You may have dysthymia, which is a prolonged sense of depression, where it might be the blues, if you will, that you get up, you do your daily activities, you go to work, you clean, you cook, you do the things you need to do, but you're just sad all of the time. So that's dysthymia. Depressive mood disorders, a major recurring a mood disorder is where you perhaps don't like or feel joy in the activities that you once used to enjoy. You withdraw, you isolate, your body aches, you feel fatigued.
What's that called?
Major depressive disorder is when you have that sense of depression, and it could be prolonged, and it can just keep coming back, and it can be recurrent, and that you can't get out of bed, and you can't do your activities, and you don't socialize, and you don't interact, and you withdraw, and you isolate. Those are symptoms of depression. You don't eat, or you eat more than you need to. You have notable behavioral changes, usually withdrawing from other people, and no longer liking the things that you used to like. These are common symptoms of depression itself.
And that's and other people can obviously see that in you because you're not the same anymore.
You're not. And people notice it. They said, there's something going on here. You need to talk about it. You need to do something. Or, people say you need. But it's in your best interest, and it's in your family's best interest to perhaps address it. And people who find themselves that are in a depressed state, in a low mood state, it can get worse, and it can spiral into this very dark sense of hopelessness and helplessness that can lead to more tragic thinking, perhaps even suicide ideation and a completed suicide. And so not everyone who's depressed has suicide ideation, so I think it's important for me to make that note. But we need to get ahead of this on the front end, because a person who experiences prolonged depression long enough, they run the risk of being in that state of hopelessness and helplessness for too long, then suicide ideation might be something that they contemplate.
So is this something that other people might notice first before you, really? That there's something wrong, not just I don't feel like it. It becomes more than that, and they see it?
Yes, depression impacts not only the individual that experiences the symptoms of the diagnoses, but those around you. So husbands, wives, children, friends start to feel the impact of an individual who struggles with depression.
But they might see it first?
They may see that the individual is just not, they're canceling on them. They're not doing the things that they used to do. They're not, going out to dinner. They're not going to the movies. They're not engaging. Even when they're in each other's company, they're not actively engaged. They're withdrawn. And just, if you see that in someone, it's important to reach out and ask and see what might be going on.
And because this is, as you said, this isn't just a week or, a couple of days. This is prolonged.
It's prolonged.
Can you come up and go back down, or is it pretty much straight?
Well, again, there's a number of different types of mood disorders. So you might have dysthymia that it's just straight for an extended period of time, a mood disorder that just pulls you down for several weeks. Let's say if you experience those types of symptoms for over a month and you're down in that dark abyss, that's one. But then you could have those ups and downs where you have cycles, and so you might have someone who has those ebbs and flows, and they might have something like bipolar disorder, which has episodes of depression, but then episodes of mania, which is a whole other diagnosis altogether. And so, and episodes of mania might look more neutral in many people. So you see low bouts of depression or low mood states with increases in more higher level mood states, and you see that coming in and out. So yes, to answer your question, yes, that is certainly something that could be witnessed by others and experienced by the patient or the client.
Okay, we're going to take a break. When we come back, we'll talk more about the signs and symptoms of depression and just what they look like and feel like. Stay with us.
Can I tell you a cat joke? Just kidding.
Welcome back. When we talk about depression, we know there are different types, there are different timelines and symptoms and concerns and treatments. Miranda Brown, University of Holy Cross doctoral student, joins us now to talk about those things with us. And obviously, Miranda, it's not just being sad. There are a lot of other feelings and difficulties with depression. So let's talk about that.
Yeah, so thanks for having me. Depression can look, as Dr. Salgado said, it can look so many different ways. But if we want to get a little technical and talk about maybe a diagnosis of what it looks like, the CDC says if you're experiencing some of these symptoms that I'll identify, maybe for over 2 weeks or more, they have to be persistent and kind of pervasive, but people can be anxious, hopeless, feeling hopelessness, pessimistic, or when you may see someone that's constantly negative. They may be experiencing some suicidal ideations. That's when depression may have been kind of persistent for a long time and maybe go untreated. People feeling guilty or worthless or helpless, unable to concentrate, and maybe having difficulty sleeping, and even having some difficulty with their digestive system, and maybe seeking medical treatment and nothing is helping those things. That's when you maybe need to look into some deeper care to see if depression could be what we're dealing with at that time.
So it's still like you can still function. I mean, you're still going through a lot of the things you normally do on a daily basis. It's just something inside is different.
Some people can. Some people can actually, depending on the level of depression and the way, how long maybe they've been experiencing depression, some people may actually get to the point where they physically can't get out of bed and do the normal things that they've been doing. In some of my work, I've seen where people just can't hold jobs because of their depression levels and the levels of treatment that they might need, and the fact that they may have gone untreated so long, and now it's at a point where they really need a lot of work in order to get better, to be able to do those normal functional things.
So what are some of the risk factors that we might look out for?
Yeah, so some risk factors, one of the biggest ones can be genetics. It can be, as someone would say, passed down. You can look at parents or grandparents, family members that may have experienced some of these symptoms, and then maybe look at the people in their family and see if other people experienced these things as well. That could be a risk factor, just genetics. And then you have people who have experienced maybe trauma or something really life-altering, loss of someone that turned into maybe depression. It might have started as normal grief, like Dr. Salgado talked about, but then it can be longer and maybe lead into depression. So big things happening and people just not being able to recover from those things could also be a risk factor. Some medications can cause mood changes as well. So we have to be aware of that and make sure we're understanding those things prior to taking medications. And then some illnesses. So maybe if someone is experiencing a chronic illness, chronic pain is a huge one that I've seen in my work, where people are experiencing chronic pain and a chronic diagnosis, and it just brings them down, and they're just unable to really move forward from what they're experiencing.
And to that point, that's a very important thing to make note of, that comorbidities or having another diagnosis, such as a medical diagnosis, an illness, perhaps an autoimmune condition, or some other type of diagnosed physiological disease, that oftentimes is linked to and works in tandem with depression. And depression is a subset of that other condition. So it's something to keep mindful of. The prescribed medications as well. Furthermore, substance use, alcohol use, and certain depressants, those things are not helpful either. So if you have a person who struggles with alcoholism or drug addiction of some sort, those things can perhaps be factors or other risk factors that contribute to depression in and of itself.
I know when you're talking about, when you're in constant pain, boy, you can understand how it just be oppressive and depressing.
Right, and when a person who has that constant pain, if they've been prescribed to medication, but then that medication now becomes an addictive component too, because that's another thing. So you have the pain, then you have the addiction associated with the prescribed medication, and then the depression that goes with that. It's a triple whammy, if you will, and then it just all feeds itself and kind of brings the person down. Now,
let's talk about treatment for a minute. I guess there are varied treatments then, because this is a varied disorder. I guess, is it a disorder?
It's a disorder.
Absolutely.
So what do you look at?
So I think one thing could be psychotherapy, where people are going to counseling regularly. And another thing could be prescribing medication. But the best course of action, I think, to get optimal treatment would be medication and psychotherapy combined. The two working together, they take care of two different pieces. Teaching people how to cope and how to live and how to function is one thing that happens in psychotherapy. And then that medication can then deal with the chemical, the physiological things that are happening inside the brain at that time.
So can you help yourself before you take that step, or do you just really need to jump in there?
Well, it depends on each individual case. I would say, based on my experience in 20 years of doing this, that if you catch it early enough, or if you have someone that's on the milder side or has minimal symptoms of depression, perhaps they, along with their support system, can pull themselves out by the bootstraps and move through it. However, if it's if it's gotten to a point where there's such a hopelessness and helplessness, and it's more of a severe or extreme level of diagnoses, it becomes that much more challenging to kind of just pull yourself by your bootstraps and snap out of it. You really would need the work and help of professionals, perhaps a team of professionals, and a certain level of care that would offer both medication and psychotherapy combined. Okay,
so if you start with a good support group, there's rely on them.
That's key. That's important. We have lots of individuals that find themselves in a depressive mood state or a diagnosis of depression who don't have that, who don't have family, who don't have friends, who don't have that support, those resources that adds to that state of depressive experience, versus those who do have resources and who do have a support system that helps them kind of elevate and pull themselves out of their lived experience.
Miranda, my guess is also that sometimes the quote-unquote support around you can be like, snap out of it, get up, what's wrong with you? Those kinds of things, which are so helpful, really, you know, when you really all should say that to each other. No, but you know, I mean, it's just, that's got to be, makes it worse, just the well-meaning comments from other people, you know?
Absolutely. And I was just thinking, as we were talking about this, some part of depression can also be isolation, where people are kind of retreating into themselves. So having a good support system and people that can recognize that is super helpful, but also sometimes they don't have those people. And you're right, because people don't understand these diagnoses and these symptoms often, then it's something that people will encourage folks to just snap out of or get over it, or, you know, it's not that bad, you know, and just say really unhelpful things, honestly. But if we're all educated a little better, I think we could help each other more when we're noticing those things in our friends and our family members.
And this is old and young. We're not talking, there's no age that this really can't hit, right?
Absolutely. In my experience, I've seen children that have shown signs of depression early. It usually shows up as anxiety for them. A lot of the diagnoses come when people are adults, though. That is what we mostly would see, I think, in our work. So yeah, people can be diagnosed at any point in time, but that's usually when we see it. And just thinking about even the elder population, the geriatric population and their, you know, phase of life that they might be in, I've seen them be in depression just because of this kind of end of life phase. So there are different levels and different age groups that depression looks different in, but it can affect anybody.
Yes, you know, with young children in particular, to add to the symptoms that you might see in a young child, anger, fits of rage, and just aggressive behaviors. You might have a 4-year-old child who's biting and spitting and kicking. They don't have the words to express what they're feeling. And so in that absence of vocabulary to express what they're feeling, they act out and they hit and they kick. And so when you see a young child who's behaving in a way that seems unruly and unmanageable, perhaps it could be a manifestation of depression in that young age because they don't have the words to articulate what it is that they're experiencing.
So sometimes, I guess, in normal activities that can, I don't know, accelerate or something that just, then you're saying, what? Can normal activities look or mask?
And it can. And so when we see these types of normal activities, if you see an overly aggressive young child or someone, an adolescent who is withdrawn, because it might be something that we see in that stage of life, that we pay attention to this and we just become present for the person. If we're a loved one, a neighbor, a friend, a teacher, that we let them know we're here for you. You know, and to that point that you said earlier about sometimes we say the wrong thing, just snap out of it. It'll get better. You know, and even something as innocuous seeming as it'll get better is not very helpful because we can't guarantee that. But something very benign such as I'm here for you, that's something that we can all say that is true if we mean it, and that can be very helpful when people realize that they're not alone.
That is true, yeah. So Miranda, is there a timeline, and I know this is an unfair question, is there a timeline for recovery? I mean, do you say,
Yeah, there isn't, honestly. And it goes back to depending on the person, the individual, how long they've been dealing with this in their life and what they're doing to recover. You know, it can be long term. Some people may need medication for the rest of their life, and others may be able to take medication for a short time and then learn how to manage their emotions and thoughts and feelings and things in psychotherapy. So it just depends on what people are doing to get their healing and maintain it, and then, how long they've been suffering.
Okay. All right. Well, thank you so much for talking with us and all your advice and everything. We really appreciate your explanations.
Thank you.
Sure. We'll be back in a moment. Stay with us.
Louisiana needs a hero.
Someone to look after it, preserve it.
We have to do something now.
If everybody took care of their spot, we wouldn't have this conversation.
We all have to do our part.
The power is yours. All you have to do is pick it up.
Care about it. Protect it. Save it.
Be an everyday hero.
Keep Louisiana beautiful.
we're back talking about depression and how it affects us. But can we also affect it? We can, can't we?
We can. Mind over matter.
Yay.
And so we can affect depression. You know, if you have the skill set to be able to implement the tools that you would acquire in counseling, for example, coupled with the support of others, you can overcome depression. It's more challenging for some individuals if there are other factors coming into play, like we mentioned earlier, such as a chronic illness, for example. Someone who's struggling with a chronic illness, the symptom of the chronic illness can oftentimes also be the symptoms associated with depression. So it's both physiological and emotional or psychological. So those might be a little more challenging because it's hard to overcome a but mind over matter. People have overcome physical ailments and get through their days and through their lives with it well enough. So with all that, yes, it is possible.
And you know, I'm just going to say this: Can you try and change your outlook? I know it's difficult when you're in the pit to, you know, look up and say, "Wow, those clouds are pretty. I'm so thankful for the clouds." But
redirecting one's attention, you know, I always equate that negative mindset and that sense of helplessness, that dark mindset, with a bowl of soup, if you will. You know, I might have chicken noodle soup and I might have the noodles in there, the chicken, and then the broth and the different vegetables, the carrots, the potatoes, all of it, and it looks so great, and then all of a sudden I see a hair. I'm like, oh, there's a hair in my soup. But if I prepared the soup, it's my hair. And so I just simply take that out. You know, I could be the person that really focuses on the hair and then everything around it is ignored, and I'm not paying attention to the wonderful ingredients of the soup. I'm only focused on the hair. But if I take the hair out, the hair is there, but then I can enjoy the rest of the soup. So the same thing with our experiences in our life. We may have something, for let's say with an illness. You might have an illness. You know, that's, you know, our health is a significant, if not the most important thing. But let's say you do have an illness that can very understandably bring you down to the point where you're depressed. Focusing on that is not going to be helpful. Redirecting your attention to the other things, perhaps. You have yet another day. Today is another day, and in that day you have your family. You have your partner, your spouse, your wife, your children, grandchildren, friends. Redirecting your attention to that. You have perhaps resources, perhaps you have food on the table, you have a roof over your head, and encouraging people to really redirect their attention to what is and what they have, as opposed to focusing on what troubles them and burdens them.
So looking beyond the one thing to the whole. So I think when we're talking about depression and you kind of come off, you go by yourself and you kind of sink into, you know, you. If you can find someone or if someone finds you and gives you a hand, is that enough sometimes to just give you a breath of air?
It can be, because to tell someone to snap out of it is not helpful, but to be with someone, to walk with them, can be what helps them snap out of it, if you will. So if you find that individual who's isolated, who's withdrawn, and they're ruminating and stewing in their own thoughts, and our own thoughts can be our own worst enemies. We are our own worst enemies. Sometimes if I toil with something in my head, I create a situation in my head that is just so awful. It's so anxiety producing and so depressive. And then I present it to somebody else or what have you, and it's not that big of a deal. It actually helps me pull out of it. And so we need to be intentional when we see people who are struggling, that we're there, we're walking alongside with them, and just being in their presence, being present there with them, can help them pull out. Not necessarily saying things like snap out of it, but being alongside them can help them toward that end.
You know, when you said about thinking things, I know people who have thought things and have had and made up answers that other people would give them or said to them. I'm like, they said that to you? And like, no, but I know they would.
Right.
And that's kind of if those words come out of your mouth, you should probably rethink that, right?
Absolutely. I myself, I think about situations that I might be apprehensive in facing.
Oh, yeah. And you imagine things.
And then I imagine things. And I imagine the conversation of how it would play out and not wanting to do it and putting it off. And I create this scenario in my head, and it just is burdensome, and perhaps I might lose some sleep, and then I might even have to go to the bathroom a few more times than I feel comfortable admitting, and all of these horrible things. And then I go and I just face it, I present it, I'm like, okay, sure, not a problem. What?
Right.
I just wasted 3 days worrying about something, and then to the other person, it's not a big deal.
I know, right?
And so we find
Get past it,
that
yeah.
we are our own worst
Yes.
enemy, and our thoughts oftentimes are our own worst enemy. And if we stew with that, an idle mind is the devil's playground. If we stew in that, then our idle mind starts to go in all these different what-if scenarios that probably are not reality.
Right. But boy, that's a, I don't know what to call it, but it's a misdirection from your own head.
And we all do it.
Yes.
We all do it. And so I think that's an important thing to note, too, to not feel like
just
you're
you.
alone in this,
Yep.
that it's just you. What's wrong with me that I do this? Every human being does it. To the extent that it becomes debilitating and crippling and it can create and contribute to a depressive diagnosis, that's a whole other story. And so we need to help those who perhaps struggle with that, who are caught up in their own repetitive, cyclical, negative thinking, and help them out of that.
Yeah, that is encouraging to know that really everybody, it happens to everybody.
We all do
So
it.
that's you can get past it if you, with help.
And
that's
it's
what we're
breaking
talking
that habit, that maladaptive habit, because that's in fact what that particular symptom is, a habit.
about. Okay. You have any tips before we go?
Yes, we have tips, as we always do, and it's important that if you are struggling with depression, that a half-hour daily walk is very helpful in boosting your mood. Also, maintaining regular sleep and a regular wake-up time, just having that schedule. Regular healthy meals is very important. Do what you can as you can. Don't, be bombarded with all the things that we have to do in life. Just one thing at a time. Put one foot in front of the other. Connect with other people. Relationships are extremely important. And avoid alcohol and other substances, because that is not helpful when you're struggling with depression.
It seems to be not. Yeah.
It's not. It is a trick,
Yeah.
and alcohol and drugs just do not go hand in hand with depression at all. It makes things worse.
Okay. Well, thank you, Dr. Roy Salgado, and of course, thank you for all your colleagues at the University of Holy Cross for helping this program, and thank you for watching and being a part of Coping Today.